According to Alana Scherer in a 2016 article for the American Academy of Pediatrics, much of the research that is available on transgender youth and adults points to the dismal psychosocial outcomes faced by this population. Homelessness, substance abuse, HIV infection, depression, anxiety, self-harm, and suicidality are much higher than in the general population and are thought to be the result from family and community rejection. Now, anyone you know has the possibility to be trans, and really being rejected for the identity you go as can haunt you for the rest of your life. So don't just reject a kid if you meet them and they tell you they're transgender just because you think they're not old enough to be making that kind of decision. Now, I as a trans male, having grown up as my assigned gender, will haunt me for the rest of my life. We will never get our childhood back, and it really just kind of really makes a huge difference on your social impacts and also physical and mental. Now, I think transgender children should be supported from a young age because it really does make a difference in their mental health. It also helps for you to be more aware of the trans community around you. Now, first I will tell you about the problems that some transgender youth go through, then I will tell you about the cause of the problem, and then I will tell you about some solutions. Okay, why does starting young matter? Children need to be able to be themselves in social settings such as schools because it's where they solidify who they are, it's where they meet their friends, it's how they network. So to not be able to be who you are throughout your childhood really puts a dent in your social settings and your mental health. So, according to Christina Olsen, Lily Durwood, Madeline Demueles, and Katie Laughlin, in a 2016 article for the American Academy of Pediatrics, socially transitioned transgender children who are supported in their gender identity have developmentally normative levels of depression and only minimal elevations in anxiety, suggesting that psychopathology is not inevitable within this group. Socially transitioned transgender children have notably lower rates of internalized psychopathology than previously reported with children with gender identity disorder living as their natal sex. It is also completely terrible that transgender rights are considered such an ethical issue that most teachers don't even get proper training on how to deal with transgender children. According to Elizabeth Payne and Melissa Smith in a 2014 article for the Journal of Homosexuality, none of the patients in a teacher study had heard any mention of transgender students in their professional training programs. A fourth grade teacher felt at such a loss in supporting her transgender student that she did not know what questions to ask in order to receive useful information to feel confident. Now that I've told you about some of the problems that transgender kids go through, I'll tell you about the cause of most of the problems. Now, the very core problem of most of the things that happen with transgenders is that no one is informed about it. You would think more people would know, but they actually don't. Now, you could sit here through my speech and not listen to a word I say, but don't think for a second that takes away any responsibility you have in this situation. You as a human being are meant to treat other people decently. Do you agree? If you agree with me, then listen to me when I tell you that understanding and accepting transgender children and people in general makes a huge difference in their lives. They really just need to be accepted, and when people choose to stay ignorant and to not inform themselves, it's the reason that these children and people still face these problems today. Because it's not that the information isn't out there, it is readily available to you. You just choose not to accept it. And also, do you really want to be known as the person that doesn't accept people or treats people poorly because you don't understand them? Now, in case for some of you who still actually don't know how being transgender works, I will try to explain it in the simplest words I can. Basically, transgender is an umbrella term for someone who does not fit the regular gender norms, which includes but is not exclusive to trans males, trans females, gender fluids, and non-binaries. Now, that may seem like there's a lot of terms to remember and you think that it's going to be a lot of work, but let me tell you, it's not as hard as you think. There are 3 typical gender pronouns to use: he/him, she/her, and they/them. Now, the best way to figure that out about someone is to just ask them. And I know that may seem scary or maybe even rude to ask, and some people even have bad reactions themselves, but it's only because they're scared. They don't want this to be any more awkward than you do. A trans male does not want to be known as a trans male. He just wants to be known as a male. Same with trans females, because the only reason to make the differentiation in the first place is because even though this person may exhibit characteristics of this one gender, it's actually different. So once they tell you everything you need to know about their gender and identity, just treat them normally. That's the whole point of the speech. They just want to be treated normally. Now that I have told you about the cause of most of the problems, I will tell you about some solutions. The number one thing you can do is just be aware of the trans community around you and be aware of the ignorant people around you. You know, go to those elders that you know don't understand it and don't accept it. Talk to them about it, help them, inform them. And also, if you meet transgender children, especially ones that have really unaccepting families, and it's in your ability to do so, help them deal with their families, even if you're just standing there with them. You being there and being a support system is really important for them. And also, if you become really close with a transgender family and the parents are kind of not sure what to do, the first thing you should probably suggest for them to do is to take their child to therapy with an endocrinologist. Now, according to Alexander Kahn in a 2014 article for the American Journal of Bioethics, the WPAT, the AAP, and the AMA all support a multidisciplinary approach to the treatment of affected children and adolescents. Merely providing hormone therapy is insufficient, and patients should also receive treatment for an appropriately trained mental health professional. Now, once a child, usually from 3 to 12, is diagnosed as transgender, they will be put on puberty stoppers, which will help during their transition and make the transitioning to the new gender easier because they haven't gone through puberty yet. And now you may be thinking that this is bad for their mental and physical health, but let me tell you, there has been research done on it. According to Brendan Abel in a 2014 article for the Hastings Center report, the first study concluded that 70 patients, none of whom discontinued the hormone therapy, reported that pubertal suppression improved their psychological functioning. A follow-up study by the same researchers found that adolescents who underwent GnRH reported improved behavioral, emotional, and psychological functioning. Most of them, even though introducing any kind of drug or hormone to your body is dangerous, most of them will admit that it was worth it. So, in conclusion, we will move on. It is important for children to be recognized young and supported because it's important for that, and it's also important for you to be informed. Now, I've told you about the problems, the causes, and the solution. Now, all I tell you is to support them.